We move now to study 3, part 4. In the past 2 to 3 decades, the understanding of health has shifted from the definition of a state of complete physical, mental, and social well-being to a non-static concept which includes one's ability to adapt and self-manage. However, studies of self-management in neurodegenerative conditions such as stroke has been neglected. In stroke and self-management for the stroke survivor, attention must be paid to informal caregivers' self-management as neurodegeneration of the stroke survivor continues. A framework called Timing It Right informs when caregivers ought to be supported as they accompany stroke survivors across care environments. This framework describes 5 phases experienced in a stroke survivor's recovery journey. First, the event of stroke. Secondly, the stabilization. Third, preparation for discharge. Fourth, implementation of rehabilitation. And 5, adaptation to living in the community. Each phase highlights caregivers' needs for informational, emotional, and instrumental supports. The literature currently lacks an integrated perspective of combined psychosocial health attributes that give rise to different underlying caregiver profiles. Such latent caregiver profiles could serve as factors for long-term care use. Moreover, to improve caregivers' psychosocial health and integrate patient and caregiver services, these latent profiles may also allow for more targeted and personalized intervention. Therefore, this study had 5 main goals. First, to identify latent profiles characterized by caregiver social health characteristics using latent profile analysis. 2, to describe the profile stability and movement between profiles over time. 3, to determine if stroke rehabilitation used at 12-month post-stroke differed by the profile transition patterns. 4, to explore if patient and caregiver characteristics explain profile classification at each time point. And finally, to investigate if the identified profiles at the 3-month post-stroke influences the explanation of stroke rehab use at the 12-month post-stroke, after accounting for the effects of patient and caregiver characteristics. Here are the results. Regarding research goal 1, I essentially found 2 distinctive profiles of caregivers at each time point. Right? A profile in orange, you could see, with high burden and depression and poor health status, which I characterize as a distressed group of caregivers, and another profile in blue with moderate overall indicator scores, which I characterize as non-distressed caregivers. The characterization of the caregiver profiles support the premise that caregivers' psychosocial health is an important consideration in self-management of degenerative conditions such as stroke. While the operational definitions of caregiver psychosocial health should continue to be developed, patient-caregiver dyadic profiles, rather than just caregiver profiles, should also be explored in future research for interventions and services to be designed in more integrated fashion. Regarding the second goal of latent, profile transition stability, that the profiles had the same characteristics across time shown earlier shows stability. Aside from this, the analysis did not indicate significant differences in the transition probabilities across the 3 time points. That means the transition probability between baseline and 3-month post-stroke was similar to the probability between 3-month post-stroke and 12-month post-stroke. Notwithstanding the above findings, the non-distressed profile appeared to be more stable than the distressed profile over time. As shown in the table, among the non-distressed caregivers, the probabilities of status stability exceeded 0.90. But among the distressed caregivers, the probabilities of status stability, that means distress remaining distress at a subsequent time point, did not exceed 0.34. It is heartening to find that 3 in 4 distressed caregivers at baseline are likely to become non-distressed by 12-month post-stroke. This may be explained by caregivers' adaptation to caregiving demands over time and psychosocial support and training that some of them may have received. That 1 in 4 remain distressed could be due to their charges having greater cognitive and/or physical disabilities or challenges hampering reintegration. In pursuance of goals 3 to 5, latent profile transition analysis were performed on 8 profile transition patterns, as you could see here, by mixture modeling with maximum likelihood estimation. So here are the 8 transition patterns over time. Now, with beta coefficients stated on the regressive paths and gray color, right here, indicating statistical non-significance, I invite you to pay attention to the parts of the header in red here, and the red rectangular box found above rehabilitation use T2. Shown on screen right now is the path diagram of 2 profile transition patterns, those on the header, with non-distressed caregivers at the 12-month post-stroke time point, or T2. We see here that the association of caregiver profile T2 with rehabilitation use T2 is statistically significant. We see the same results on the other 2 profile transition patterns with non-distressed caregivers at the 12-month post-stroke, or T2. The association of caregiver profiles with rehabilitation use T2 is statistically significant. Now, in transition patterns with distressed caregivers at the 12-month time point, we observe that the association of caregiver profiles, T2, with rehabilitation use T2 did not reach statistical significance. This is the same result on the other 2 profile transition patterns with distressed caregivers at 12-month post-stroke. Therefore, regardless of the pattern of profile transitions over time, the non-distressed caregivers at 12-month post-stroke were likely to have cared for stroke rehab users at 12-month post-stroke. This result suggests that stroke rehabilitation use is associated with reduced caregiver distress at 12-month post-stroke. This study was the first to find associations between latent profiles indicated by combined caregiver psychosocial health characteristics and stroke rehabilitation use. I turn now to research goal number 4, the explanation of caregiver profiles. Among the covariates, as you could see in the diagram, patient depression was found to explain caregiver psychosocial health profile classification at baseline and at T1, 3-month post-stroke. This finding is supported by previous research and suggests that psychosocial support for caregivers should be provided as early as possible at the point of patient discharge from acute hospital. Now I invite you to pay attention to the parts of the header in blue and the blue rectangular box found, and the blue rectangular box found on the path connecting rehabilitation use T1 and rehabilitation use T2. Shown on screen now is the path diagram of 2 profile transition patterns with non-distressed caregivers at the 3-month post-stroke time point. We observe that rehabilitation use T1 explains rehabilitation use T2, right? That is expected from the literature. Now, in this diagram, we see the same result. Now, in this diagram, where distressed caregivers are found at the 3-month post-stroke time point, rehabilitation use does not explain rehab use at T2. Same result here, rehabilitation T1 doesn't explain rehabilitation use T2. Right? Therefore, I found that stroke rehabilitation users at 3-month post-stroke tended to continue using rehabilitation at 12-month post-stroke only when their caregivers were not distressed by 3 months, not distressed at 3-month post-stroke, but not when their caregivers were distressed. This finding shows that the caregiver profiles at 3-month post-stroke moderates the association between stroke rehab use at T1 and T2. Caregiver distress at the implementation phase of this timing it right framework may impact stroke rehabilitation use at the adaptation phase. Taken together, the findings of study 3 show the importance of psycho-educating caregivers of stroke survivors, identifying caregivers at risk of experiencing distress, and preparing them early in the patient's journey. Therefore, in summary, study 3 found that non-distressed caregivers at 12-month post-stroke were likely to have cared for stroke rehab users at 12 months.